William V. Williams, MD, is a rheumatology specialist in Philadelphia, Pennsylvania, with over 40 years of experience in the medical field and has worked for over 30 years in drug discovery and development. He is a graduate of Tufts University School of Medicine and practiced at the University of Pennsylvania. Dr. Williams is currently president and CEO of BriaCell Therapeutics Corporation.
Hi, this is Dr. Bill Williams, and I want to talk to you in a few different sessions here about contraceptives. Now, I've been doing drug development for over 25 years, and in that time, I've learned that it's very important to develop a drug to make sure that the benefits outweigh the risks of the drug. Because any time that you have a situation where the risks are higher than the benefits, or the harm is greater than the good, that's a poison. But for drugs, you want the benefit clearly to be greater than the risk. Now, we recently, a group of us submitted a petition to the FDA to look at hormonal-based contraceptives, and these are things like the pill, the vaginal ring, the transdermal systems, the injectables, the implantables, all of these things that act on a woman's body in order to prevent her from ovulating and prevent her from conceiving a child. Now, there's a number of very serious risks associated with these, but I don't want to talk about that in this video. I want to send a general framework because, as I mentioned, for any drug, the benefit has to outweigh the risk. And so for contraceptives, you have to ask yourself, what is the risk? What is the problem that's being addressed? And for contraceptives, unlike other drugs, there's no disease being treated. There's no pathology being reversed. There's no disorder that's being ameliorated. There is essentially no benefit to the woman other than the fact that she can, have intercourse without conceiving a child. And there are many other very effective ways that don't involve the use of drugs that can attain this, especially natural family planning-based methods, fertility awareness-based methods. These methods have now been, associated with apps that you can get on your iPhone to determine when a woman is fertile and when she's not. And she's only fertile for 5 days out of every monthly cycle. So this is something that I think should be promoted much more than these hormonally active agents, which have a number of risks that are acknowledged in the prescribing information. And this includes things like blood clots and strokes and heart attacks, weight gain, etc., some of which I'll be talking about in more detail in subsequent videos. But again, I think the overall overarching theme of these is to keep in mind that for hormonal contraceptives, there's no disease, no disorder, and no pathology that's being treated. And so this is not really a therapy, it's really a lifestyle choice medication. So as we go forward, keep that in mind, and keep in mind that for any drug, the benefit should be much greater than the risks. Thank you, Dr. Bill Williams, and I'll be hopefully connecting with you on some of these other videos.